Thank you for trying TechSmith's Camtasia Relay.
Alrighty, I'm going to try something new here. I got this new program. I'm part of the little pilot project that we're doing at Boise State with a different version of Camtasia, and I'm hoping that it will be successful. But you know how that is. Try something new and you're gambling. So anyway, I'm going to try to talk about brain or nervous system tumors. So we're talking about brain and CNS tumors here. And when you're following on in the book, which I hope you are, I'm here on page 1572. It starts with right here, nervous system tumors. So follow along in your book. I like yellow. That's just my thing. So why is that a big deal? Why are brain tumors a big deal? Well, I hope I don't tell you guys why brain tumors are a big deal. They're very lethal and very frustrating. You guys can read about locations, but I wouldn't, for the purpose of our class, I would just say brain tumor is brain tumor. That being said, when it comes to the dreaded, how well will my child do with this new diagnosis? What's going on? Well, location is a big deal. So, and let me just say this. Okay, so here's some different areas, different types of tumors, and also their area. So that's important to know when you're talking to parents, but please don't think you need to know all of this anatomy stuff as far as where they are. But they're different tumors behave differently, respond to chemotherapy and or radiation. And here's a big thing to remember. This is something I really do want you to remember. This concept right here, being benign or malignant. That's a big deal, because just because something is benign being that it doesn't continue to grow out of control. Being malignant means that it just continues to grow, i.e. it's a tumor. So a benign tumor can be very lethal because of its location in the brain. So don't start thinking that benign tumors are no big deal. They're totally a big deal. However, better to have a benign tumor than a malignant tumor. I hope you guys have learned that from another class. Okay, let me flip over here to slideshow here. If you're looking at the PowerPoints, these are PowerPoints. If you follow my cursor here, I have downloaded those into our folder. So this is something that I think is important to know. Neural tissue. So brain tumors and neuroblastoma come from neural tissues, i.e., CNS and nervous system tissue. They're usually brain and spinal cord is what we're usually talking about. 20% of all childhood cancer. So remember, this morning I was saying how leukemia is a really big deal. As far as childhood cancer, leukemia is the big one. But number 2 is nervous system tumors. Brain tumor, neuroblastoma. Those are the ones that I want you guys to know. So 60% of are intratentorial, 40% are supratentorial. Please don't worry about this one. But they are very common. If you're talking about where solid tumors are in the brain of the kids, the thought is that because their brains are growing so much, and because brains are growing so much, oftentimes you can have these extra oncologic cells that seem to grow a whole bunch. Okay, so enough of that pathophys stuff. Let's talk about the important thing, and this is very important for nurses to know. What are the signs and symptoms of a brain tumor? So that's what I'm talking about. Presenting clinical signs. We need to know that. And what are they? Think about nervous system issues. So you're talking about, let's look for it here. Where is it? I bet you there's a chart here. Let's cruise through. There's got to be a chart. Got to be a box. I don't necessarily have it. But you guys know what this. Nervous system issues here. That's something to know. The big thing is headache. Headache is a big deal in kids that can report it. So when I apologize. I'm looking for that here, but just like over here, I would want you to know. I don't have my thing here, but the presenting clinical signs are important. Any neurological thing like headache, nausea, vomiting, massive projectile vomiting. Those are all a big deal to know about because they cause right here. The increased intracranial pressure of compression of the brainstem. That's what's going on to cause kids to have this uncontrollable vomiting, but also major headache. That's a big deal. Okay, so what do we do for brain tumors? Well, just like any cancer, we're talking about chemotherapy and radiation. And remember the question of surgery. And the formula that you're thinking about when you're thinking about what we're doing treatment-wise is how small can we make the tumor through chemo and or radiation before it is surgically resected? As well as, is it even possible to surgically resect it? So when we look back over, follow me over here to my PowerPoint slide, is we're doing all these tests: MRI, CT scan, electroencephalogram, the EEG, and a lumbar puncture looking for mets, anything floating around the CNS. If there's metastasis in the CNS system, we need to be zapping those with chemo and radiation. And it's all very traumatic. This is all very, very traumatic. And some things that can be very frustrating is not knowing exactly the outcome. So let's say your child is diagnosed with a brain tumor somewhere, so a certain type of tumor, like a medulloblastoma versus astrocytoma, these fancy words. There's a huge difference between those type of tumors. Yet, for us as nurses at our level now, we're just talking about what can we do to get rid of that tumor, and therefore what's going to happen around the surgery, the radiation, the chemotherapy. That all these three things right here add up to what the prognosis is, and so it's very complicated. I can't imagine I can come up with any real good test questions to come up with a scenario because they're always different. So it could be very scary. And also, I got to tell you from experience, having surgery on your brain. Okay, let me say this: I didn't have surgery on my brain. I have not. Knock on wood, I haven't had surgery on my brain, but it's very traumatic, and it's very common to have a child who wasn't quite as functional, or isn't as functional now as they were prior to the surgery. That can be very challenging for parents because, in an effort to save their life and to take out that tumor, there can be some changes in their abilities to do their ADLs, their activities of daily life. They can range the variable range is complicated as far as they could just have a little off behaviors. They could have trouble remembering things. They could have a little trouble seeing out of the far corner of their left eye, or they could be very vegetative after the surgery, and that's very scary, traumatic time for a family when their child's having a tumor removed. Especially anytime surgery is scary, but brain tumors is especially tricky. So we want to be aware of all those issues. But you guys can read through all of these neurological issues. This paragraph is a pretty good paragraph, I think, as far as neurological conditions post surgery. That's a big deal. And you guys can read this paragraph here about preventing post-op complications. Yes, we're doing that big time. That's for all of our post-op patients, and checking neurological function frequently following brain surgery. That's a big deal to know. This thing right here is keeping track of your drainage from the surgical site. That's kind of old school thought. It still is important, but you guys be doing that for all your drainage from any dressing that you had. That's important to know. Let's move on with this PowerPoint here. So here's all the things you're going to be doing in this. This PowerPoint is kind of summarizing what's here in the chapter. I'm hoping this is working for you guys. Again, this is new. So you can read about all the specific things that nurses would do if there are this, but they all revolve around neurological things. That's what I want you guys to remember: neurological assessment post-operatively. And just like every condition we have, we're supporting child and family after all that. Okay, let's move on to neuroblastoma. So what's the difference, you ask? Well, they're technically not brain tumors because they're the most common malignant extracranial. It means tumor outside the head. So just know that a neuroblastoma is a tumor that is not a brain tumor, but is still somewhere along the neurological system, usually along the spinal cord, spinal canal. So a lot of times these are down in the chest, or often the, right here, the retroperitoneal chain here. So that's where you see it down in the abdomen is technically where it is. But sometimes head, but not inside the brain. Head, neck, chest, or pelvis. Those are where you see them all. Neuroblastoma. So yes, they're nerves, but they're all everybody. So read this. This is important because neuroblastomas are notoriously late detected tumors. They don't they're not affecting any certain organ. So sometimes it's hard to get it. Oh, it is. You're here. I already highlighted it. Metastasis occurs. The diagnosis is made after you get mets. That's a real common thing in kids. Is you already have metastasis, and so you're trying to figure out what's going on. Well, they're the biopsy result of that tumor in your chest or in your kidney or somewhere is a neuroblastoma. Then you find where the original site was, and then that's how you get diagnosed with neuroblastoma. But obviously, when you have metastasis, you have a poor prognosis, and it's going to be a lot more challenging to get into remission and therefore get off treatment. So, lots of tests. Check all these tests to figure out what's going on here. Is it a neuroblastoma? Yes or no? Well, got to do a bunch of tests. So that's a big deal when they're getting worked up for a diagnosis of neuroblastoma, is trying to figure out where it is. So we're doing all sorts of testing, and then once they are diagnosed, then it's just pretty much the brain surgery pathway. Only it's not a tumor in the brain, but we're talking about chemo and radiation to shrink the tumor in the hope of removal at a later date. We're always trying to shrink those tumors so the surgery is less minor invasiveness as possible. So remember that. And you guys know about chemotherapy, so all your studying for leukemia can translate into all the studying for neuroblastoma brain tumors, as far as being able to explain what's going on with this chemotherapy and what's it doing to the kids when you're talking to your parents. So here's some stats on survival rate. So it's pretty good. It always depends, again, on the staging. That's always the big deal. Let me see if there's anything over here. So we just talked about this, talked about that. And we're always, when you say locating primary site, again, mets, if there's mets everywhere, you got to figure out what kind of tumor it is. And staging is a big deal. And I've already said that. I'll get it together on these slides here. But anyway, I'm just covering the book here as far as what it talks about with brain tumors and neuroblastomas. And I like this summary. I'll conclude with this nice sentence. Be sure and read that sentence, because we say it all the time, and I feel like I keep minimizing it, but boy, the parents really need a nice amount of support when they're dealing with these diagnoses. And you can't just teach them everything they need to know that first day. Constant support and reinforcement about what's going on and what they need to know, and getting them in on the lifestyle of being the cancer patient family. So that's what I had. Let me see if I can make this thing stop, and hopefully it's going to work.
Thank you for trying TechSmith's Camtasia Relay.